Y'all, we need to do Amanda Talks right now about Dr. Potter. Amanda Talks. Yeah. I don't even want to sit down for this one. So heated. So, Dr. Potter. We met her a couple weeks ago when I posted a video about her getting a cease and desist from United Health. Okay, so if you don't remember, let's recap. Dr. Potter is a surgeon, and she does flaps, double mastectomies. She does breast reconstruction. She's a superhero of a doctor. Well, last we heard, she got a cease and desist from United Health for posting a video talking about how United Health was not going to cover her patient's stay in the hospital that night when that patient was literally getting a deep flap surgery as Dr. Potter was talking to United Health. So if you want to recap that video, go look at it. Go watch it. That's where you need to start. Welcome to Dr. Potter, part 2. I'm going to play the video. So Dr. Potter, she comes on TikTok and she's like, yo, everybody. United Health is getting out of control. And Dr. Potter's not wrong. United Health is getting out of control. Or should I say all healthcare is getting out of control, especially in this country. So this is an update.
I wish that it didn't keep happening, but I have a peer-to-peer scheduled on Tuesday with an insurance company. It's in the middle of my operative day, doing breast reconstruction. The time they offered was right in the middle, and need to do a deep flap for a patient, and they want me to do it as an outpatient. They denied the inpatient stay for the deep flap.
An outpatient means you will go home after that surgery. Okay? It means you will walk in, get major surgery, and then go home after. They want you to walk out.
And want me to call them in the middle of my day to explain why it needs to be inpatient. I wish that it didn't keep happening, but...
Sorry, I keep pausing this. Why would a doctor have to take time out of that doctor's day, whether something should be inpatient or not, even though it's already been inpatient this entire time? Okay, we need to explain what the difference between outpatient and inpatient is. So let's break it down. When you're an outpatient, it means you get out after. You go to surgery and you get out. When you're an inpatient, it means you go to surgery and then you stay in after. So Dr. Potter had a patient that was getting a deep flap, which is usually it's cancer related, and it's a deep flap. You know, I'm not a doctor, but let me tell you, I think it has something to do with deep in a muscle flapping of some sort. That doesn't sound like an outpatient activity to me. It doesn't. As somebody who had half their colon removed and couldn't get up for 3 days after, even though they told me I could, I'm telling you. That sounds like an inpatient thing to me. You want to be inpatient. You want to be a patient in after surgery, right? Colonoscopies, outpatient. You can walk out, right? Not really a big deal. Examples of outpatient, inpatient, okay? Outpatient, colonoscopy. You can walk the heck out. We love that. Go get a colonoscopy. Super easy, breezy, covered, squirrel. Inpatient, or things like that. Maybe United. Just wanted to throw that out there. Yeah. So that's what Dr. Potter's fighting for. So Dr. Potter had to schedule a meeting with United Health to argue this case. And the only time they had was during a surgery. Again, she leaves a surgery to make a phone call. She's like, hey, I would love my patient that I'm doing surgery on right now to have a hospital stay afterwards, inpatient. And they're like, but why? You're not the doctor. So she says, okay, I want a doctor. I'm going to argue this. You need to let me talk to a doctor. This is ridiculous. So the next video that she makes, this is in real life. Like, I can't make this up. This is, like, every day I open my TikTok and poor Dr. Potter is she's posting another video.
Hey guys, it's Dr. Potter. I wanted to update you about the peer-to-peer call that I had scheduled. You may remember I had a patient who needs a deep flap, and the insurance company denied an inpatient stay for her. So I had to schedule a peer-to-peer call and schedule time out of my day to ask
Peer-to-peer means that she requested to talk to a doctor about the situation. Say, okay, the insurance company is being crazy. I need a peer-to-peer call. Like, you need to put a doctor on the phone with me about this because this is outrageous. Peer-to-peer, doctor to doctor.
To ask for a conversation directly with someone who was my peer to discuss deep flap surgery and why that patient needed to be overnight. That call was scheduled for 11 a.m. and 11 came around, 11:30, 11:45, and no call still. And then we emailed the insurance company because, of course, they don't give me the call number. They only let me receive the call. So finally at 12:15, I received the call that was initially scheduled for 11. And the doctor who called me was not a surgeon. And I actually asked the doctor, do you know what a deep flap is? And the doctor said no. So that's where we are.
I don't even know how to, I'm laughing, but I want to cry. I don't know what a deep flap is. You know what? Let's take a look up what a deep flap is together, because I don't even know what a deep flap is, but I can tell you that she definitely can't walk out afterwards, okay? You definitely can't be walking out after that. That sounds pretty deep.
My patient has insurance. She's seeing someone who's fellowship trained in microsurgery, me, to do her breast reconstruction. And I'm having to teach another doctor what a deep flap is in order to justify her overnight stay to navigate her insurance. This is completely ridiculous.
Wow.
Hey guys, it's Dr. Potter.
And she's literally having to teach another doctor. I have to see how outrageous this is. Now, try being the doctor. It's obviously hard for the doctor to provide good care when they are working in an environment like this. I need you to try being the patient in this environment. This is really, really, really terrible. We've taken the care out of healthcare. We've taken the health out of healthcare. There's literally like, but.
Hey, it's Dr. Potter. Can you just tell me your name one more time? I'm sorry, you won't give me your name? I don't understand the relationship. I'm just asking for your name so that I know what doctor I'm speaking with. If we're doing a peer-to-peer, I just want to know who you are. So United won't let you give your name out for security reasons. Can you tell me what specialty you are? Did you do breast reconstruction? You did not do breast reconstruction. Okay, is it her plan that's not allowing her to have this, or United? Does she have a plan exclusion? Can you send me that evaluation? Like, can I see their reasoning and thought process when they've reviewed the literature to see what they reviewed? I mean, you understand this is this patient's one chance to have sensation preserved. And I do think that it's very reasonable to do this as a fellowship trained microsurgeon. I think it's very reasonable to dissect out the fourth intercostal nerve and to graft that to the dermatosensory elements on the nipple to try to give her this chance.
Oh, okay. So she's literally having to teach. She's telling the doctor on the phone what a deep flap is. It makes it sound like it's a very small window of opportunity for you to have this sensation in your nipples to come back after this deep flap. So
yeah, I would just love to see where United has gone through that data. I mean, I'm a physician, I'm a doctor, and I feel like I'm making a medical decision for my patient. It seems like United is making a medical determination about this. And I don't exactly know how that works, right? It seems like they're practicing medicine. I just want to read it like a paper, right? And see what the references are so I can understand. Can you email it to me? You're not allowed to email it to me? It's an internal resource.
I haven't seen.
I mean, there's data from 2023 and 2024 showing that this is effective. Yeah, I really would love to read that and see what United is using as the data to support that. And this is her only chance, right? Okay. Yeah, I'll do an internal appeal. Yeah, and I appreciate your time, and I'm so sorry that y'all aren't allowed to give out your names as a fellow physician. Like, I would love to be able to talk to you like you were a peer, but it's crazy. Yeah. Well, best of luck to you, and I appreciate we will appeal. Thanks. Bye.
That doctor didn't even know what a deep flap is. When the doctor asked him, could you give me significant evidence to why United won't be adhering to my requests, they're like, oh, we don't have to. We can't give you that email. That sounds really like gangster to me. That sounds like mobster to me. Like low key. Like, is United Health like, are they a mob over here? Shit. You know, poor Dr. Potter. Thanks for listening to Dr. Potter's story. I want to hear how you feel about this. Loud and clear. Drop it down below. I want to hear it because I know you've been denied for things as a patient, and I want to hear what it's been for. Tell me what you've been denied for. Let's really talk about them because I think we need to. Not just United. All healthcare. All health insurance, right? Let's put the care back in healthcare. So go follow Dr. Potter. Send her some love. And if you are a medical professional, she's asking you to reach out and give her some information and support her in this advocacy journey that she's really doing alone against United Health. So we love her. Not all heroes wear capes. Dr. Potter, thank you again. Thank you. We appreciate all your hard work. And everybody, thank you for watching. Stay out of trouble, but most importantly, stay beautiful. Bye.